12 days. That's all they have to get it done. And if they don't, millions of you are going to be paying 30, 50, 100% more for your health insurance in just a few days. Now, I hope lawmakers enjoyed their week off for Thanksgiving because time is running out to stop the financial cliff that is coming for those who use the Affordable Care Act for health insurance. So here's what's going on. Congress is returning to Washington, D.C. tomorrow, and the #1 agenda item is figuring out what to do about these Affordable Care Act subsidies. Now, I've been warning that this healthcare cliff was coming for months. The cliff is due to two specific things. #1, because of inflation and the tariffs, the health insurance companies have just raised their prices for just about everything. And #2, because the enhanced ACA premium subsidies for qualified participants are expiring at the end of 2025. For the record, those who are not in this country legally do not qualify for ACA health insurance, and they most certainly do not qualify for these particular subsidies. On top of that, as I reported in this video, the numbers show that the vast majority of people who get these ACA subsidies live in red states that voted for President Trump. Now, I bring that up because it's very important to what is coming next, and that is, what is Congress going to do about these expiring subsidies? Right now, there's not a lot they can do about the general price increase, but subsidies? That is in Congress's wheelhouse, and there are options. But you have to understand the politics that goes with each of those options because that will determine whether anything gets done. The calendar also matters. So let me tell you about that first. The House recess calendar for the month of December shows that there are only 12 days that the House of Representatives will be in session in the month of December. You can see from December 22nd through the rest of December, they are on recess. And then there's some random days throughout December that they are also on recess. Now, of course, the calendar can be changed or amended, but as of now, they've got 12 days to get this done. That is not a lot of time. Okay, so option 1, by some miracle, Congress comes up with an entirely new healthcare system and passes it through both the House and the Senate, and the president signs it into law, and that would fix this healthcare cliff. Now, whether they can do that in 12 days, highly unlikely. Option 2, they can extend the current enhanced ACA subsidies for a short amount of time so the 45 million Americans who are enrolled in the ACA don't fall off that cliff while Congress figures out some kind of permanent healthcare solution. Now, that is something that President Trump has floated. More on that in a second. Or option 3, they can do nothing and let millions of Americans fall off the healthcare cliff and pay a boat ton more for their health insurance, which would then likely cause millions of people to just not get health insurance, which then means when they get sick, they clog up emergency rooms that are required by law to see them and treat them, whether they can pay or not. This is also a real option given the short amount of time that Congress has to get this done. But I want to talk about option 2 for a second. In the last few days, we've heard President Trump floating an idea like option 2. We all know he hates the Affordable Care Act, also known as Obamacare, and so do a lot of Republicans. Trump has been saying since he first ran for office, way back in 2015, that the ACA should be repealed and replaced. Replaced with what? I don't know. Trump has never once released an actual healthcare policy to replace the ACA. That is a fact. And Republicans have not put out anything that has been able to pass both the House and the Senate either. Also a fact. Trump has said he has concepts of a plan. He said he will release his healthcare plan in 2 weeks. That was years ago. And recently, he's been floating this idea of giving the healthcare subsidy money directly to the people so they can then buy their own health insurance. Look, healthcare has always been a tough issue for Republicans and for Trump specifically, especially since the Democrats passed Obamacare. Now, lots of Republicans hate the idea of giving subsidy money directly to people. Lots of them also hate the idea of extending the ACA subsidies even more. But remember how I said in this video that the majority of those subsidies are going to people living in red states? One thing about President Trump is he knows his voters, and he is absolutely aware that his voters are getting these ACA subsidies. And if they fall off the cliff, they are going to be pissed. He does not want to see that happen, especially right now with everything else going on in this country. So what is going to happen with healthcare? We'll know within the next 12 days.